What's good, fam? It's your boy, Jorge. Welcome to another episode of Hanging with the Boys. Today, I got a repeat guest. A lot of people are asking for you.
Really?
Yeah.
I'm glad.
I think, it says something about the listener, I think, that we all have issues.
Yeah. Oh, yeah.
So,
And curious and just wanting to know things.
Yeah. So, Josee, thank you for coming back on.
You're welcome. Happy to be here.
Yeah. So, last time you were on, we talked a lot about women in abusive relationships.
Yes.
And then just about like certain marriage type stuff like that.
Yeah. We did there at the end, right?
Yeah.
We did.
So I think a lot of people did, they're curious to hear more about just the mental health aspect of your work, I guess.
Okay.
Real fast before we start though, did you see the whole Trump RFK coming out saying that Tylenol causes autism?
I've been talking about that for years.
Oh, you have?
Yes.
Maybe get the
because
mic a little closer.
There is a study that was done by I don't know who. It's a long time ago.
Mm-hmm.
And, it's I don't think it's been replicated, so it may have been dismissed. But this gentleman, he was a psychologist or psychiatrist, a doctor, I'm not quite sure what his credentials are, but he was interested in why there was this increase in autism beginning in like early 90s. So he went, and it was increasing all over the world.
Mm-hmm.
So he said, and a lot of people in those days thought it was from the thimerosal in the vaccines. They took that out, didn't change anything. And so he was curious as to what was going on. And I remember when I was younger, the rate of autism was 1 in 10,000 people.
Right.
Now it's 1 in 50.
Mm-hmm.
Some statistics I've read is 1 in 38.
Yeah, I saw that. Yeah.
So he went all over the world looking for what was different and where was an area where there was not a high degree of autism.
Mm-hmm.
And what he found is Cuba.
Mm-hmm.
Now, Cuba, you don't have a choice there about vaccines.
Mm-hmm.
So 99% of their children were vaccinated.
Okay.
But yet there was a very low incidence of autism. So what he looked at was what is different in Cuba than the rest of the world. And what he found out was the Tylenol was not an over-the-counter drug.
Mm.
You had to have a prescription for it.
Okay.
And he looked at the rise in the use of Tylenol, and it is very close to the rise in autism. I just thought, this was an interesting study, read the papers that he did, and yet nothing ever became of it, So I'm very interested to see what RFK has come out with. He didn't actually. This is from the Harvard Mental Health Institute or whatever it's called.
Mm-hmm.
So he is looking at studies that they did, and there's 2 or 3 different places, if I remember right, that were collaborative working on this. So I'll be interested to see it.
Yeah, I think just the way that Trump comes out speaking about it, it makes people kind of cringe about it, and it's like, well, where's your data? And
he says
stuff
a
like
lot
that.
of things that are cringeworthy.
Yeah, but then if you kind of do look at it, I thought from that aspect, what you were kind of talking about, being from a different country. Back then, you didn't really see autism or anything like that, and it made me think. I'm like, well, maybe because we probably didn't have Tylenol over there,
Yeah.
So exactly what you just said. So it makes sense, but I think he's just coming out kind of saying like it causes it, and it's like it may cause it,
Let's do some more study.
Yeah.
There was also, doctors that were telling, I would ask my own children, because I have an autistic grandson, and I said, what do they do? They get baby shots, a whole lot of them,
Right.
even as very young. And I said, what do they tell you to do? And she said, they tell you to take Tylenol, give the child Tylenol before he comes in for his shots, because then if he gets a fever or anything, it's kind of a precautionary medication. And I thought, well, that's very interesting. So that's maybe why it's connected with the vaccinations, is because people were told to give their children the Tylenol before shots. Now, my own grandson, when he went to get his vaccinations, as soon as they gave him the vaccination, he had seizures. Yeah, right there in the doctor's office.
Wow.
So I think it's worth looking at.
Yeah.
Yeah.
Yeah, I know. The vaccine stuff's tough. There's they really push. It's flu season, so they really push the flu. I got the flu once, and I thought I was gonna die. So, but then I think we gave our kids the flu shot maybe once or twice, and then after that, they just hate needles and the whole thing. So I'm like, all right, you know what? It's your choice now. So you get the flu. It's really bad. I don't know how it is for like little kids. It's probably better than how it affected a grown person. But just know that. So if you get sick and you get the flu, that's on you. Or you could get this that might not get you the flu.
So I got a flu shot once, and I thought I was going to die.
From the flu
From
shot.
the flu shot.
Yeah.
I don't do well with.
Yeah. So I knew someone that, and that all started because I knew someone that got the flu shot and then ended up being allergic to eggs after it.
Yeah. There's
So
something about that.
Yeah. So I was like, oh, really?
Yeah.
And she's like, yeah, I always ate eggs. And then after I got this one flu shot, I was allergic and I can't have eggs no more.
There is another medication, something. I don't know, it's a vaccine, but it does change people's ability to tolerate certain kinds of food. Yeah.
I wonder if they can, so that can happen. So why can't they make vaccines that kind of give you like mutant powers, like the X-Men, right? That'd be great.
Do we really want that?
I kind of want that. That'd be cool.
Well, you're a nice person.
Yeah.
And you're a good person. Think about that for bad people, evil people.
Well, it's like Peter says, with great power comes great responsibility. Yeah.
Yes.
I
was going to go back to the autism thing.
Yeah.
I was listening to RFK, and he said, how many 70 or 80-year-olds do you know with autism? I did not know one person with autism when I was growing up.
Yeah.
And yet, in the night, you can just see it. In 1990.
I think he also said that with gay people. I think he also said that the same, which that makes sense though, because you do look up.
Yeah.
And he also said, I think he's trying to say like gay comes from something other than just being born like that. So he was saying, look at the older people. There's not really many homosexual people compared to now.
I think people may be just more honest about it.
Yeah, maybe.
There isn't the, in our country and most Western countries anyway, there isn't a terrible consequences if you say you're gay.
Right.
As opposed to some other countries, that's a death sentence.
Yeah.
So also, there is a difference we did not know about soya milk and soya products for a long time, that they are absorbed in the body the same as estrogen. So that could be having an effect on, hormones.
They say goldfish have a ton of that, and kids just
goldfish,
yeah, the snacks. Yeah. So I don't let my kids eat goldfish.
I was just reading about goldfish the other day, that the color is actually a natural color, so they don't need to change.
Oh, okay.
I don't know about soya stuff though.
Yeah.
I'd be careful.
Yeah.
Yeah.
Plus, they don't really need that snacks. So it's not just because of that. It's not like I'm that mean of a person, but I'm like, well, they don't also need just handfuls and handfuls of goldfish all the time. So
yeah, it's a lot of salt.
Yeah. I'm sure there's a lot of sugar in it too. What are the most common mental health challenges you see at your practice?
Challenges. Having enough clinicians. We have 12 clinicians working, some of them part-time, some of them pretty much full-time, and we're still busy.
Yeah.
I mean, I have a waiting list. I have a cancellation list that people get in on. Otherwise, I think it doesn't take long for a new clinician to have a sufficient number of clients, and they can't take any more, because to really do a good job,
Right.
Sometimes you have to see people every week, and then you kind of make it longer as they get better. But I'd say right now, and I'd say even not just in our practice, but in a lot of practices, not enough psychiatrists, very few psychiatrists, and just not enough clinicians. We have several interns. We would like to have fully licensed people.
Yeah.
Yeah.
So it's tough. You guys have just a ton of, and I think we talked about this last time, but you saw like a big spike come up since COVID?
Oh, yeah.
Okay.
Especially with children.
Oh, really?
Yeah, children, their whole social development was disrupted for what, 2.5 years? And it really saw, when children are exposed to that level of fear, for them, they don't understand. And so their life, if they were very young, it's like they were taught to be fearful. They were wearing masks. They couldn't be around other people, even their grandparents. In some cases, a lot of them, there were grandparents who died. So they grew up being fearful. So you see a lot more anxiety and depression.
Okay, so that's kind of the biggest thing that for kids right now, it's like the anxiety and depression caused by.
Yeah.
Yeah.
Also, if you look at middle school kids, you're seeing a lot of anxiety and just adjustment disorders, because they don't have the skills to handle social media. And I've seen like 8 and 9-year-olds who have their own telephone and who are on it and have a hard time putting it down even during session.
Oh, wow.
Yeah.
Yeah. Both my kids have cell phones, but it's more of so I could kind of track where they're at.
Yeah.
Only my oldest had a phone, and he's 11.
Yeah.
But he went to the same school as my youngest, but now he moved up to middle school.
Oh, yeah.
So my youngest is at that school, elementary himself. Yeah. So they both have phones, but they, the oldest one, I've noticed that he's kind of on it a lot more now, because a lot of his friends now, since they're in middle school, they're on it. So they're texting and calling.
Yes.
But he's not on it really playing games or really watching too much stuff. He'll listen to music here and there, but it's more just the communicating with friends.
Yeah, I think it's something they like to do.
Yeah.
It keeps them in touch. It wasn't a lot different, when my kids were young, they could call their friends up.
Yeah.
So that's important at that age, particularly in middle school, to have that connection socially, to be going out with their friends and inviting them over. Yeah,
I remember that was one of my main things. I was always on the phone, so if I got in trouble, I couldn't use the landline anymore.
Right.
And that's for all you young kids. That's a phone that's attached to your home.
Yeah, with a cord.
Yeah.
Can't get away from it.
Yeah, landline. That's funny. What's your definition of anxiety?
A feeling of nervousness. Many people feel it in their chest, their stomach. Constant movement, there's physical signs, there's internal signs, but nervousness, that inability to sit still or to keep your thoughts focused, feelings of something bad's going to happen, and anxiety can get so bad that you can have panic attacks. Those are something separate. It's a separate diagnosis.
Because from anxiety or cause
it's an
different
extreme anxiety, but it typically isn't caused. It isn't a progression from, gee, I'm anxious today, now I'm going to have a panic attack.
Right.
Two separate things.
Okay.
Because you can have severe anxiety but not have panic attacks. Like I said, two different diagnoses. And there are different kinds of diagnoses for anxiety. There's social anxiety, people who are fine when they're home.
Yeah.
But little kids, you send them to school or going to Walmart because Walmart's big and noisy. Being around a lot of people, that's afraid to talk to people, that's social anxiety. But then there's what's called generalized anxiety. That typically has a hereditary component to it, where inherit the same brain chemistry as some of their parents or grandparents.
Yeah.
And so they're just born kind of anxious people.
Mm.
And then it's generalized. They always are feeling it.
When you say born into it, so it wasn't like a genetic thing. It's more you're born into that situation, that atmosphere?
No.
No? It is a genetics?
Yeah.
Oh, okay.
Hereditary. Because you'll see it just run through families, just the same as depression, substance abuse, schizophrenia, bipolar, or mood disorders. Highly hereditary.
Okay. Yeah. But can adults get anxiety later in life?
Yeah, there's a difference between being anxious because you're in a situation that is anxiety producing.
Right.
For instance, you're going to go get a new job and you're going to the interview and you might really be anxious about it because you don't speak well, or you're afraid they're going to ask you a question that you don't have the answer for. So people get anxious. That's called situational. But when we talk about a diagnosis, it's chronic. And you'll see symptoms when there's a genetic component to it. You'll see the symptoms start to arise, usually when children are about 12, even a little earlier, some kids even a little earlier, but it starts to come out in those middle school years, which makes it even more difficult for kids.
Right.
Yeah.
Speaking of the situational one that you said, is that something, so say like, I remember always, and I tell my kids this, it's very important, just getting the nervous, like when you're going to go somewhere and do a sport or something and you get nervous, I always tell them, that's okay. If you weren't nervous, it doesn't matter to you.
Right.
So you're nervous because you want to do good and stuff. Is that kind of a situational?
That's just situational.
Okay.
Yeah.
But that's not obviously a bad thing.
No.
Okay.
No, I mean, feelings are so important because they don't lie to us.
Right.
We can rationalize things in our head, in our mind, but physically and our feelings, emotionally, they don't lie. So when we are anxious or nervous about something, that's telling us, hey, pay attention. Try to see what's going on. See if you can change something. That's very normal. I mean, it's a new situation. So it's typical that people would be anxious.
Okay. Yeah. What's the best way to deal if it's not like a genetic thing, you kind of just get it a little bit later in life, or maybe still genetic. But what's some tips you could do that you could give someone they could do themselves?
Depends on the type of anxiety.
Yeah. Like just like a normal, just
hey, I'm anxious.
You're scared, you're afraid of the future because you don't know what the future brings.
Okay, that's different than what I was going to say.
Okay, what were you going to say? We'll go back to that.
I was going to say like a person who is very anxious about driving, because I've had a couple of patients, more than a couple.
But always, or they had an accident and became that way?
No, they're just
always.
Maybe they heard about an accident. Some of them have had accidents.
But they developed the anxiety from the accident?
Sometimes.
Okay.
The fear.
Right.
But it doesn't generalize. It's just around that one thing. But most people who have that anxiety about driving, it's like, I feel anxious. I've got all the physical feelings of anxiety. So there must be a reason for it. So they look for a reason. And maybe it's, a freeway. They can drive in the streets, but they can't get on the freeway.
Yeah.
So I tell them, you got to drive there every day. Even if it's just from one exit to another, you have to drive, because it's the only way to address fear is to step into it and say, I'm really blunt, and I tell people, I don't care if you're puking. You drive on the freeway. Yeah. And you go from one exit to the other, and the next day you do that. You do that for about a week, and then the next week you go 2 exits. Because the only way to overcome fear is to face it. Yeah. And I say, you got to be courageous. That's what courage is, when we're scared, but we do something anyway. To have courage.
Okay.
Be brave.
Yeah, so that makes sense, to a normal person. But so say, it's interesting that you brought up that it kind of seems like, and we'll get into maybe the prescription stuff a little bit later. But it seems like a lot of things is mental, and you said you're kind of just talking yourself to a worse situation. So yes, you might have this anxiety, but the way you speak to yourself is why you get it a little bit more than or whatever.
Well,
so
there's a saying in psychology: feed a psychosis, starve an anxiety. So, in other words, you don't feed anxiety. You don't feed into it. You face it.
Right.
You don't let people not do things because they're scared of it.
So what's the trick then, though? Because say I'm scared, I go get off on the thing. I could get off and say, okay, well, I didn't die, but then I can go back into my head and say, like, but what if I do next time? Yeah. So what do you do then?
Don't keep doing it.
Just keep doing it.
Keep doing it.
Repetition.
Yeah.
Okay. Yeah. And then eventually they hopefully get over it.
Some people do very well.
Right. Okay. So say now something that's not so specific as like just I'm scared to drive, but I know a lot of people that might have fear of the future because it's unknown and you don't really know what's gonna happen, or like if is your job gonna be there, your health and all that stuff.
They get stuck in what I call the what if.
Yeah.
What if I lose my job? What if my husband divorces me? What if my kid gets sick? What if? I tell them, answer the question.
Yeah.
What if you lose your job?
Get a new one.
Exactly.
Right. Yeah.
But they get stuck in the fear.
Right.
So it's always the what if. And I say, you've got to answer the question. Whatever fear comes up, answer the question. What if my child dies? Yeah, what if your child dies?
Yeah.
You're going to grieve. It's going to hurt.
Yeah.
It's going to be terrible. But you get up and you go to work and you fix dinner and you work in your garden. You do whatever. You normalize as much as possible. Yeah. Eventually, that sadness will be something that you can bear. You're not going to forget it. It's not like it's not going to be there on his birthday or whatever. You survive. You live. Because he's not the only person in the world. There are a lot of other people that you can help. And usually you have a family that you still have to pay attention to them.
That one's a tough one because you don't really have a say, or you can't do anything about that.
No.
Someone passing away, that you have no say. So it's almost like, why would you live your life in that fear when you can't do anything about it?
And too, if people have a spiritual component to their life, I think that's very helpful. People who have religion, not necessarily, doesn't have to be a specific religion, it can just be a spirituality, belief system, that there is some type of life, there's something on the other side, that there is a power that is above you. I've got a hair here that's bothering me. Something over here.
Yeah.
So that can be helpful. It's a tool, and I will use any tool I can to help people.
Okay.
Yeah.
Let's get into depression. You brought that up earlier. Is the depression?
Let's not get into depression. That would be bad.
Yeah.
We can talk about it.
Well, let's talk about it. I won't get into it. Is depression, would you say it's the same as a genetic thing, or just people kind of get it throughout their life?
Again, there's chronic and there's situational.
Okay.
I mean, chronic is, it's in your family. You're predisposed to it. You have stressors that then may make it worse. Remember, there's from mild to severe and everything in between. So some people who has maybe a parent who is bipolar, they may get mild depression or moderate depression. They may not have bipolar, but it's still a mood disorder. There are things like cyclothymia, which is you're kind of at baseline, and then you go down into a depression, and then you come back up to baseline. And it's cyclical. Some people will have it for they'll be fine for about 4 or 5 weeks, and then they'll go into a 2-week depression, and then they'll come back up. They don't get manic, and they don't stay depressed. It's just called cyclothymia. It's kind of a different, you don't see that very much. So mood disorders run in families, and it can be anywhere from bipolar to mild depression to severe depression, what we call major depressive disorder, where there's suicidal thinking, just everything's black.
And that's just
hard.
natural
That's
as far as for them. It's not like they're doing anything to
No.
worsen it.
no.
Mm,
And that's when you look at medication and different kind of treatments, as well as counseling.
Mhm.
You typically should have somebody around to monitor, to talk to,
Yeah.
etc. But then there's situational depression. It's funny because people will come in to see me, and they'll say things like, I had this really terrible thing happen to me, and I should be over it. Why am I crying?
Mm.
Like somebody in their family died.
Yeah.
And they'll say, it's been 3 months. And I'll say, how long did you know this person? Well, I knew them all my life.
Yeah.
3 months is nothing.
Right.
Allow yourself time to grieve.
Okay. Do you, by chance, know you're talking about genetics and stuff, how genetics works and how, say you have 2 kids and you have heart disease in the family, but one kid gets it and the other one doesn't. Yep. What's the jump there?
I'm not a geneticist, so I
Mm-hmm.
can't answer that. But I know I always relate it to like diabetes.
Mm-hmm.
If you have diabetes in your family and your parents said, just eat as much sugar as you want, don't worry about exercising, don't worry about eating well, just do whatever you like.
Mm-hmm.
Good chance you're going to get diabetes, right?
Yeah.
But if they said, hey, look, diabetes runs in our family, so you need to watch what you eat. We're going to have your blood checked every year. We're going to really be careful about exercise, so that you don't get diabetes.
Mm-hmm.
Or not severe. Maybe you can get a mild type. I don't know that about diabetes. The same thing happens with brain chemistry. You have a child whose parent maybe is bipolar, so they're predisposed to get a mood disorder. But if their life is nice and happy and they have friends and they go to school and they don't have a lot of stressors, they may get some mild depression or they may avoid it.
Mm.
But you give them some stressors. Parents get divorced.
Yeah.
There's domestic violence. There's, somebody dies. That stressor then can make it worse.
Mm.
Yeah.
Can develop it more.
Yeah.
What about, and that's from a parent to a child. What if can it skip?
Oh yeah.
Some grandparents and then
you'll see that a lot with addiction.
Mm.
Like maybe the grandparents were alcoholics.
Yeah.
Or drug addicts, and the parents said, I don't want to be like my parents, so I'm never going to drink. So the kid never sees their parents drink, not around it a lot, and they go to a party when they're a teenager and start drinking.
Mm-hmm.
It's already there.
Yeah.
If they've got addiction on one side of their family, 50% chance that they're going to be addicted. If there's addiction on both sides, 80% chance they're going to be addicted.
Wow, that's crazy.
It's hard. Yeah.
Do you think this is how it's always been, even like Egyptian times? And
Yeah.
it's always
if
just
you
been
look
like
at
that.
populations, and I'm not picking on any particular group of people. This is just hereditary genetic stuff. Okay, Irish, Russians, Hungarians,
They like to drink.
Native Americans have high rates of alcoholism because there's that genetic component, and it just keeps. And particularly like. If there's a lot of closed kind of societies, and then they marry within a clan or a group, you're going to get it even more. Yeah. I always tell people, like, when I look in my drawer of closed files for alcohol, it's the Mooks and the Macs because they're Irish.
Yeah.
Yeah.
That's interesting.
And it's not because people are bad or they don't know any better.
Yeah.
Yeah.
That's crazy.
Watch out, particularly with addiction. If you don't get hangovers, if you can drink much more than other people and not appear drunk, it's a bad sign. Because then it tells you your brain chemistry. It's like ready. Yeah.
Huh. That's pretty wild. So we can't really escape none of this stuff. Except with,
you can escape by not using anything that's addictive. I allow chocolate, but no drugs, no alcohol.
Yeah.
Because your brain's going to turn on.
Huh. So I know you can't condone this, but hearing this as a parent, maybe I should get my kid drunk when he's a little bit older,
No,
just to see if
no.
because he might they're probably just gonna do it themselves, right? Just so I could see, like, hey, did you like that? And if they're like, nah, that wasn't cool, then we're okay.
I don't know.
Well, like I said, you can't condone it, but
Well, I wouldn't mess around with somebody's brain chemistry.
yeah. But the odds of them not ever having a sip of alcohol is what?
Well, it depends.
Yeah.
Some people never drink. I don't drink. Because to me, it's already shown to be directly related to 8 different cancers. And in women, particularly breast cancer.
Oh, really?
Yeah. So I don't think anybody should put alcohol in their brain.
Right.
Or drugs. I even avoid prescription drugs that are addictive. I don't have addiction in my family. I'm really blessed. My brother did happen to make his own, but started at a young age with cannabis. But there was like no alcoholism or anything. So I'm blessed in that way. But, people don't intend to become addicted. I don't think anybody said, gee, I can't wake up. I wait till I grow up and I have to have alcohol every day and spend all my money on it.
Yeah.
Maybe lose my job and my wife and husband, whatever. Nobody sees that. They think they're going to be in control of it, but it isn't them. It's their brain chemistry. Now, other people who are what we call social drinkers, or, they get drunk once in a while, go to a party. Those people who don't have that genetic component, they can quit drinking. It's the lack of control, the loss of control, that makes it a disorder. Make sense?
Yeah. Do you think there's because I have a lot of social drinker friends.
Oh, yeah?
But you just said a social drinker that drinks here and there, right? So say that here and there is a lot more often, but they're more of the social drinker. Do you think still that they could stop, or is that...
Depends on their genetic background.
Okay.
Yeah. You're in your 30s?
40.
40? By this time, you would see the people who began drinking at a young age, particularly before 20-some years old. Kids who start 14, 15, 13 years old and have that genetic component, man, you're going to see the damage in their life by the time they're in their 30s and 40s. Right. Yeah. I mean, some people drink every day, but they're not alcoholics. They come home from work, they have a beer or a cocktail or a glass of wine. They sit and watch TV or read a book or go to the gym, whatever they do, play with their kids. They're not alcoholics.
Yeah, but at what point are they alcoholics? So
it's a continuum. It's in a one-way continuum. There's use, okay? That's the first step. If you've never had any alcohol in your life, you're not on the continuum. Once you have a drink, that's use. So you have a cocktail, glass of wine, whatever, that's use. Then there's misuse. That's, I can't go to sleep until I have my cannabis or my alcohol.
Yeah.
Or I can't talk to that person over there that I'm interested in without drinking first.
Right.
That's misuse of a product because alcohol is not a sleep aid.
It's your crutch.
Yeah.
Okay.
So they use it, that's a misuse of the product. And then there's abuse, where you begin to have a craving for it. You're using it, you're driving after you've had too many, but you're going to drive anyway. You get in arguments with your spouse or your girlfriend, boyfriend, and it's causing that because you're drinking too much. That's abuse.
Okay, so
then it moves into addiction, dependence.
Oh, so we're not even there yet.
No, that's when you really lose control.
And the addiction is where you need it.
Yeah.
To function.
Yeah, and there's people who, I've talked to people who will say, I don't even want this. I'm sick of it. My life is going to hell.
Yeah.
But I need it. Yeah, and that's really severe. They've changed a lot of that to mild, moderate, severe. Same criteria, though.
Okay, that's interesting.
Yeah.
Huh. And in your practice, you deal with a lot of people with addiction?
Well, I'm dually licensed, so I'm an MFT plus licensed clinical alcohol and drug counselor.
Mm-hmm.
They changed the letters, LCADC. So I have a dual license for alcohol and drugs
and then
counseling.
So you see a wide variety of abuse and drug addicts and all that kind of stuff. Are the alcohol addicts the worst ones that you see? No?
Fentanyl, heroin.
Oh, okay.
Any opiates. Because they're deadly. They're just...
But I mean, as far as like
fast.
temperamental kind of, just like the way they act, is alcohol a little bit more dangerous than the other drugs?
Nope.
No?
You drive impaired, you're driving impaired, whether it's alcohol or fentanyl or methamphetamines. You'll see some drugs faster. Alcohol can take years, till your liver's damaged and you've gone through 3 marriages and lost a ton of jobs. That takes time.
Yeah.
Alcohol's slower. People are able to function their whole lives with it, really. Methamphetamines, you're going to have damage pretty quickly, and quick addiction.
Yeah.
Opiates, fentanyl, heroin, quick.
Fentanyl is an opiate?
Yeah.
Considered? Okay. How does one get addicted to fentanyl?
Take it.
Just taking it.
Just take it.
Because I mean, they make it sound like it's so dangerous that, and there's like videos that go around.
Oh, yeah, it is.
And I know maybe they're fake or whatever, but just like a cop opening up. That's real?
It'll kill you.
Okay.
Yeah.
But then how can someone consume it in that type?
They usually put it in heroin or another product.
Mm-hmm.
And I had one person tell me that he had a broken foot or something. They gave him, what is an opiate?
Oxy?
Yeah, Oxycontin.
Uh-huh.
And after that, they gave him something else. And he tried fentanyl with heroin. He said it was the best feeling in the world.
Yeah.
He said it was like a giant hug.
Mm.
And from there, he was gone.
So you can't even just do it once because it's like that
I'm
good.
sure some people can.
Yeah.
But people like it.
Mm-hmm.
And it depends on your brain chemistry. Because some people take methamphetamine and say, God, why does anybody do that?
Yeah.
I'm into cannabis or alcohol. Depends on your brain chemistry, what you like best.
And I've heard on another podcast that there was like a professor that was at either Stanford or somewhere up there in the East Bay. And they were saying that he was known for doing meth, but he would, go home, do meth, but then he would show up to his job and he was a professor there.
He probably had.
So he was like a working.
He probably had ADD.
Oh, okay.
Yeah.
That's funny.
Because ADD brains are different.
Mm-hmm.
And it's same with bipolar. A bipolar person, that's how I used to tell if they're truly bipolar or if it's the methamphetamine. Person who is taking a lot of methamphetamine. And I asked them, the first time you took it, how did it feel? They said, it made me feel better. I could concentrate.
Mm-hmm.
Because their brain is different.
Yeah.
Then people with ADD, the medications they give them are a type of amphetamine.
Mm-hmm.
Methylphenidate, Adderall, Ritalin, because they need more stimulation in their brain, so they don't get high from it. So that professor could have had really severe ADD and took his meth, and it made him feel normal.
Yeah.
Able to concentrate. And
just the stigma that obviously you put out for drugs and meth. So someone telling me like, oh yeah, that guy does meth, but he's a professor and stuff. You kind of look at him bad, but I'd never once thought like, oh, maybe he has some mental issues where he needs that too.
Because most people don't function well on meth.
Yeah.
So if you see a person who is, I don't know why this professor would prefer to do that rather than get medication that's a lot cleaner. Because this meth, you could never tell what's in it.
Right.
Yeah.
Okay, I think the last show I did, or maybe the one before that, I talked about, and we were talking about Adderall, and I kind of was trying to explain it. So I said that basically someone with ADHD, it'll calm them down, right? Because their brain is everywhere. So it'll calm them down. But then someone that's normal and takes Adderall, it does the opposite. But if it like laser focuses you, but it does the opposite as well.
Well, I think you think you're laser focused.
Oh, okay.
What happens in a person with ADD? There's 5 types of brain waves: alpha, beta, theta, delta, gamma. Delta is typically when you're sleeping, but beta is like what we're doing right now. Alpha is a more relaxed state, and if you get theta is right before you fall asleep, and there's a state called alpha theta, which is a very relaxed but alert state. When you play video games, you're probably in that state of mind.
Really?
Yeah, because you have to pay attention.
Right.
It's relaxing, right?
Yeah, it's fun.
And you get in that kind of alpha theta place.
Okay.
And it can be very relaxing. Slot machines do the same thing. And people like it. It feels good in their brain. And then there's theta before you fall, delta when you're asleep. And people with ADD, sometimes the theta waves are too slow. And so when you see a kid who's hyper or an adult and they just can't sit still, that's because they're trying to engage the frontal lobe of the brain. And the frontal lobe is the part that is what we call executive functioning, makes decisions, etc. Kind of a filter. So in people with ADD, again, depending on severity, they're trying to get more stimulus in their brain by moving around or creating chaos. You'll have kids who will deliberately do things to get people arguing because they've got to turn their brain on. And that works for them. So
once they succeed, something in their brain turns that on and they kind of calm down then?
No, that's when you give them coffee, any type of stimulant, then that can give them enough stimulus in their brain so that they don't behave in that way. Yeah.
Okay. And ADHD is something genetic, or you kind of get it later on?
No. Although I worry a lot about TikTok. Because TikTok has certain segments, right? And they're all the same length. So what is it teaching you if you're on TikTok?
Just to scroll, yeah.
You can pay attention this long. And then you're going to need another dopamine hit. So you got another one. So it's training your brain to only be able to pay attention this long.
Okay.
Same thing with advertising on TV. If you'll notice, when they started out, it was every 20 minutes. There was an ad. I think it's more than that now.
Yeah.
And if you see children's programs, there's a lot of hyper stuff. And that can actually change your brain if you watch enough of it.
Yeah.
But that 20 minutes is because the brain needs a break every 20 minutes. It gets bored.
Yeah.
So.
Wants to see something different. Yeah. Okay. So ADHD, and then there was ADD.
Same thing. There's actually 6 different kinds of. According to Daniel Amen, who is really the expert in attention deficit disorder, ADD, is attention deficit disorder without the hyperactivity component. But then there's ADHD, which is attention deficit hyperactivity disorder, what we called ADD combined.
So the ADD, those are the ones that, like the kids that couldn't pay attention but weren't disruptive.
Yeah. So you'll see them just sitting in class, maybe spacing out, looking somewhere else. Yeah.
And what's going on in their brain?
Same thing.
So
just need more stimulus.
Okay, so that's where like Ritalin came in?
Ritalin, Adderall, methylphenidate.
To help them focus because they have the attention deficit.
Yeah, and it's an amphetamine-based medication, so it stimulates the brainwaves.
So does coffee do the same for them as ADHD? Or something like that?
Yeah, any stimulant.
Okay.
So sometimes when people don't want to give their kids medication because It's like an amphetamine. So if
Yeah.
kid loses their appetite, they don't gain weight, they don't grow. Some of them will get facial tics or movement in their hands, just like a meth addict, that can be permanent. So a lot of parents don't want to give their kids medication. And so I tell them, give them coffee.
That's interesting.
Without sugar.
Yeah, because I've seen kids that have like, they have like little tics, and I just
facial
thought,
tics.
okay, so they're probably on something.
Maybe.
Or they're not on something
Or they could just have tics.
Yeah. Okay.
That's another disorder.
Yeah. Dang. Can't. How are we normal?
It's complex.
Or maybe I'm not normal. Maybe I just think I'm normal. Maybe I got a bunch of problems that are undiagnosed.
It's funny because when you look at what the Diagnostic and Statistical Manual, the DSM, it has all the criteria for any type of mental health disorder, right? And there's a ton of them. But if you looked at everybody, typically you could give them a diagnosis at that period of time anyway. Not everyone, but some people come in and they just have a problem. They're going through a divorce or, custody battle or just struggling with work. But you have to give them, now those kind of people preferably would not have a diagnosis because they're just going through typical stuff. But the insurance company says you have to have a diagnosis, right? And they won't pay for what's called Z codes, which are family problems, et cetera, et cetera. So you have to give them a diagnosis. So you give them an adjustment disorder. That means they have a stressor.
What do you think about nowadays? I think it's been on the rise of people self-diagnosing themselves through like ChatGPT or just Google.
Yes.
What do you think?
Well, I see people who come in and say, I think I'm autistic.
Right. That's huge right now.
Oh, yeah. It's trendy. And I'll say, because I've talked to them for 20 minutes, and I'll say, no, you're not autistic.
Okay.
You don't meet the criteria. No, you don't get to be in that class.
They leave bummed out.
No, because it's how you present it.
Yeah.
Another one is people come in and complain that their husband, their wife, their boyfriend, their mother, their father are narcissistic. That is another trendy one. A true narcissistic diagnosis is very rare. I've probably only known 2 truly diagnosable narcissistic personality disorder in 20, 25 years.
So that word's more is used a lot more freely. Just trying to say someone is this instead of, it's like a slur in a way, instead of actually being diagnosed. Because I didn't even know you could be diagnosed for that. So
it's a personality disorder in those categories.
It's a bad personality. Bad personality.
I won't swear. They're not nice people, or they're perceived not to be nice people. But a lot of people will say that person's narcissistic simply because they're not giving them what they want.
Right.
So, oh my God, if you're not giving me what you want, you're self-centered and you're a narcissist. No, they just don't want to give you that.
Yeah. To me, a lot of this is pretty wild because just growing up in like a Hispanic household, back in the day, my parents are old school and everything. I never knew about disorders until, I was older. And then I always thought like it was just people just doing it. So, for example, if you say, someone, I've seen a few people that are like maybe in their late 20s, 30s now, and they're coming out and they're like, you know what, I always thought I was a little bit different. They lived their whole life kind of normalish, you know them.
Yeah.
And then they come out and they say, I always thought I was a little bit different or whatever, but then now through like ChatGPT or whatever, they self-diagnose and they're like, oh, I'm actually autistic. And then to me, I just think I'm like, no, you're just an idiot. You're just a weirdo. Like I always thought you were just weird. Not,
I think people look for other reasons for behavior and outcomes instead of saying, I did this and I made a bad decision. I wasn't thinking clearly. So maybe I need to change.
Yeah.
Other people go undiagnosed until they're adults.
Yeah.
And then, especially with ADD or ADHD, and then you you think, how did you survive for 40 years?
Yeah.
You know?
Yeah. But it happens.
Oh, yeah. And it's, their lives are chaotic.
I think there should be reparations for that.
Reparations?
Yeah.
For ADD?
Well, anything. I go to you and you're like, hey, you're actually kind of autistic. I think I should get something for that because I've gone 41 years.
You know, another thing, people come in and tell me that they are borderline personality disorder.
Mm-hmm.
And I was thinking,
well, what is that?
That's another personality disorder. There's called clusters of them.
Like schizo is one of them?
No, that's schizophrenia. That's a psychotic disorder.
Oh, okay.
I'm going to have to give you a DSM. You can read up on this,
Yeah.
this thing. Personality disorders have, again, a genetic component to them. Like serial killers generally are called psychopaths. The technical term is antisocial personality disorder. That means they don't have feelings for other people.
And that's a personality?
That's a personality disorder. And in other words, you're born with it.
So you're saying a psychopath would fall under that category, but a schizo falls under a different category?
Schizophrenia is a different disorder entirely.
Oh, okay.
You know, schizophrenia has auditory or visual or delusions, paranoia. Depends. Different kinds of schizophrenia.
Has there ever been a serial killer that's been schizophrenic?
I don't know if they'd be that well organized.
Oh, okay.
Yeah. Typically.
So there's a big difference.
I mean, they may kill people.
Right.
But perfectly sane people kill people.
Right.
You know? But what we call sociopaths or psychopaths are really antisocial personality disorder. Very dangerous people. Very dangerous. They do not feel at all.
And that's genetic.
Highly genetic component.
Okay.
Yeah.
Because I watched a show. I forget what it was called. I think it was called Manhunter or something like that on Netflix.
Mindhunters?
Mindhunter?
Great book. I read the book.
Yeah. So
Yes.
It was about the serial killers.
Yeah.
And a big thing they all had in common were like the mother-son relationship. So I guess from the show, I kind of got that they had a mommy problem.
Mostly because most serial killers are men, but there's been some women.
Okay.
Yeah.
So that, that's where I was like, okay, so they have hey, be nice to my son, to my wife. Hey, be a good mom. You don't want him to become a serial killer. But that's kind of what I took. It's that they had issues, like, they say daddy issues, they had mommy issues. So they kind of grew up.
You know what? Some people grow up in very good homes. You don't have to be violent to have, to be a psychopath or sociopath. You can grow up and be a politician. Don't care about other people, just want power. Yeah. Power is very important.
Donald Trump.
So, so there are people in business. The one thing about them is they're very charming people. That's why Trump is not a sociopath, because he is not charming.
He's kind of charming.
He's got a sense of humor.
That's okay.
And he has. Yeah. He certainly is nice to people. I mean, he's kind. When people have died or things, he's very caring in that way. But he isn't charming. He doesn't have all the right words just sliding out of his mouth all the time. And that's a big red flag for people like that.
Charming. Man.
Yeah.
It's not good. I'm charming. That kind of sounds like a narcissist too, though, right?
Narcissism is a personality disorder. It's just in another category. The difference between a narcissist and antisocial personality disorder is that narcissists aren't intending to be mean. They think they're special.
And the other one is they have no feelings to anything.
Deliberately know what they're doing.
Right.
Like to harm people. When they're beating somebody up or getting one over on people, man, they're calm. Heart rate goes down. Galvanic skin response goes down. Just lie like it's the truth.
But you were saying you've only diagnosed like 2 people, or you've known 2 people. But it seems like that kind of characteristic is a lot of people. So how do you classify someone to actually diagnose
Most
someone
people know when they're being inappropriate. Going to the front of the line, they may be an ass, but
they know.
But they know they're being an ass.
Okay.
Narcissists kind of just think they deserve it.
So they don't know. They actually don't know that they're doing anything wrong.
And they don't generally have feelings for other people because they're special.
Yeah. It's all about them.
It's about me.
Okay. I see. Can we talk about OCD real quick? I think one of my co-hosts, she was talking about it, and I just didn't get it.
Oh.
Because she had an example of like something about like having a favorite spoon or something like that, or fork, and just all this stuff. And she's not saying she's OCD, but she has some traits, I think. So can you explain OCD to me?
OCD is an anxiety disorder. It's another type of anxiety disorder. It can be the obsessive compulsive disorder, OCD. So the obsessive part does not have to be physical, like washing your hands 16 times a day or every 5 minutes. It can be mental as obsessive thoughts over and over and over, what we call ruminating thoughts. Or they're driving down the street and they hit a speed bump. And they say, oh my God, I think I killed somebody. So they run around the block and they don't find a body. Oh my God, I just injured him. They got up and ran away. So they go around the block again, looking for the person that they hit. And in some ways they know it's not real. Some people do. But they can't quit doing that thought.
Okay.
Yeah. Some people have really bad ruminating thoughts. I'm a bad person. I'm not worthwhile. And they just can't get it out of their mind. So that's the obsessive part of it, or they obsess about something.
In a bad way.
Well, it's distressful. Yeah. And that's the thing about mental illness, is when it causes distress. If it's not distressing you, I'm okay with it.
Okay.
If you like washing your hands 20 times in a minute, it's not distressful for you. What can I do? The compulsive part is they have to act. Like, I knew a person who couldn't leave his house without touching the couch so many times. And then he had to touch the door so many times. And he had a whole ritual. And that I find a little bit easier to work with. Usually people who have the obsessive part of it, medications work, like Paxil. Some antidepressants will address that.
The thought part.
Yeah.
Yep.
People with compulsions, there was a person I knew who could not hang the clothes up unless the hanger was touched a number of times. And it took hours to hang the clothes up in the room. And so I said, do you have a chair in your room? She said, yeah. I said, don't hang your clothes up. Put them on the back of the chair. So it took that anxiety away about, oh my God, I'm going to spend an hour hanging up my clothes. Just simply don't hang up your clothes. As we did that enough, washing dishes was another thing. Had to wash the dish so many times on each side, then rinse it, then do it over again, and a specific amount of times. And I think in this case it was even numbers or odd numbers, and then they could put them in the dishwasher. So I said, don't do that.
Yeah.
Rinse them, put them in. Or
and if they don't, that's when the obsessive part comes in, that there's something that's going to happen because of that action, of not doing it.
Yeah.
Okay.
Something bad's going to happen if I don't do this. It's kind of magical. thinking kind of thing.
Yeah.
But again, it's like I call it a loop in the brain. So the amygdala might be firing, oh my God, something bad's going to happen. And it just gets in a loop. It never makes it to the frontal lobe that says, nothing bad's going to happen and you're okay and you don't have to do this.
Yeah.
So it gets stuck in the brain.
Okay.
Sometimes for that, there's a treatment called prescribing the symptom, which you tell them to do it over and over and over again, and then they get sick of it. Sometimes.
Yeah.
And that works good with kids.
And what do you think, like, how does one just one day, so this person has this, right? OCD. But what is it that made them do that, like the hanger thing?
Anxiety,
So one day they just had to do laundry. They got anxiety over it.
Signs from even being a kid.
Okay.
Yeah.
Because it's kind of weird that those are the specific things that certain people.
The tendency is already there as a kid.
Right.
Like I will share with you that I count eggs.
You count eggs?
I know there's 12 in a dozen.
Mm-hmm.
But when I take them out, like you used to have it on the door of your fridge and you put your egg, I would count them. I know there's 12 eggs, but somewhere along the line, I counted them and it just stuck. Yeah. I don't do that anymore because I don't have one of those on my fridge. Some people count stairs.
I do something like that. Like when I clean and say like I'm wiping something down, I have to count how many times I wipe it.
Yeah.
But it's not.
But you don't have to. I mean,
I don't have to.
You can leave the house, move on to the next thing. Yeah. And it doesn't stick in your brain. But people.
No, when I'm doing it, sometimes I wonder why. My camera just went off, so it's just going to be yours. But we'll keep it going.
I think our brains are set up to organize. And so, it's just kind of an extension of that or an exaggeration of organizing. Yeah.
Interesting. Okay, so to end the show, since we talked about all these disorders and stuff like that, is there anything in your brain that actually does good for you? Like, is there something like that? And is there something that we can do to exercise that more so we can be a little bit happier?
Yeah, don't drink alcohol.
Okay.
Don't do drugs. Don't smoke cigarettes. Mostly, because you're heating up your lungs, you're preventing the oxygen to getting to your brain.
Oh, okay.
Sleep well. If you have a sleep disorder, see a sleep specialist because you want people with sleep problems don't get enough oxygen in their brain. So you want nice, healthy brain. I mean, we do things to our brain that we would never do to our body.
Right.
Like alcohol.
Yeah.
Or drugs. It's like giving yourself a frontal lobotomy.
And that's
messing up your brain.
Yeah.
Exercise, diet, vitamins, doing all those things that are just healthy for your brain.
Okay.
Yeah. Get help when you need it. Allow yourself to express your emotions appropriately. Don't be afraid to grieve when you have loss. Have somebody to talk to. I'm biased. I think everybody needs to be in counseling because we all need somebody to talk to. So just have a healthy brain. Now, if you do have a predisposition, get help early.
Okay. What if? What's your advice for someone that maybe doesn't know their family history, so that you wouldn't know?
That's hard because I do have patients who adopted and they don't know. But that's the same thing with things like multiple sclerosis or diabetes or heart problems or cancers. They don't know. And so they're kind of left with whatever comes up. Then they have to address it.
Yeah.
But usually it'll show up.
Right.
If it's genetic.
Yeah. And we're in a time now where the information is more out there.
Yes. And there isn't that stigma.
Yeah.
I mean, my parents were that way. Even when I was, into my 20s, people did, just pull yourself up by your bootstraps.
Yeah.
Get over it. What are you sad about? You got a great life.
Mm-hmm.
We didn't know about brain chemicals until the 1990s.
Mm.
So before that, it was all guessing and theory. And now we know more about the brain, and still not enough.
Okay. So it's important to maybe get checked out, just have a session here and there, and just to see what's going on. And you could be totally normal, or you could have some issues.
We avoid that.
Normal?
Normal.
I'm not in the field, so I could say all that stuff.
Yeah. We just look at, I'm an existentialist counselor. So when you look at behaviorism, I think it's very, very important. It's not as popular anymore as it used to be, say in the 60s. But look at people's behavior. Behavior will tell you more than words. And if their behavior is inappropriate, out of appropriate, what most people do, there could be a problem.
There could be something going on. Yeah. Okay. Makes sense.
Thank you. I hope this was helpful.
No, this is great. I learned a lot. Like I said, I don't really know much about anything. I just kind of hear here and there, and I kind of dive in sometimes, or I just kind of, I just listen. But then, it's having a professional on here telling us.
Anytime, because I could talk about this for hours.
Yeah.
We could go through every diagnosis.
Well, if my camera didn't die right there, we could keep going for a little bit longer. But we'll end it today. So hopefully we'll see what everyone says and have you back.
Great. Thank you very much.
All right. Thanks for coming.
Mm-hmm.